Hello everyone, my name is Radwa. I did my presentation for this week on colon cancer, so let's get started. So our agenda for today, we will discuss our patient, we'll discuss her symptoms and any relevant history that she has. We'll also discuss any physical findings, as well as her diagnosis and relevant diagnostic testing, as well as her treatment plan. So let's meet our patient. Our patient goes by Katie. She is a 74-year-old woman who presents to an urgent care center with a chief complaint of bloating, constipation, and abdominal discomfort for approximately 3 months. She was in a normal state of health prior to that. Upon further evaluation, the patient stated that she has had some unintentional weight loss. The last colonoscopy was negative 2 years ago. She denies having any allergies to food, medications, or environmental. She has a significant past medical and surgical history, which includes her hysterectomy about 12 years ago, as well as hypertension. Her family history, her mother has passed away at the age of 52 from stroke, and her father is still living and has colon cancer. For medications, she's on lisinopril for her hypertension. For her social history, she used to smoke. She used to smoke about 1 pack a day for 9 years. She did, however, quit 15 years ago. She's a social drinker, and her diet is she is on the processed food slash meat. For her physical exam, she's afebrile. Blood pressure is within normal ranges, 110/67. Heart rate is 65. Respiratory rate is 18. She's sat in 98 on room air. And she has a BMI of 35.15. For general appearance, our patient is in no apparent distress. She's awake, alert, oriented times 4, answers all questions appropriately, and follows commands. For a clinical presentation, on her physical exam, it reveals distended abdominal girth, hypoactive bowel sounds, and tenderness noted to her right upper quadrant, right lower quadrant, and left lower quadrant. Our patient is diagnosed with colon cancer. Patients are diagnosed with colon cancer based on their images via colonoscopy, their lab testing results, as well as clinical presentations and their signs and symptoms. For clinical features, beside what our patient has had, you would also see bleeding per rectum. You'll also see abdominal pain, changes in bowel habits. Um, like our patients has, you'll see weight loss as well as abdominal mass. One's risk factor for developing colon cancer would include their diet, which is mostly on animal fat, and in her case, she's eating processed food as well as meat. Um, Also, hereditary syndromes would place you at a risk for developing colon cancer, inflammatory bowel diseases, as well as tobacco use. How are these patients diagnosed? Well, first we'll do a complete blood count for them, which would include their WBCs, their RBCs, their hemoglobin and hematocrit level, platelets, their neutral level, MCV, MCH, MCHC, RDW, BDW, and MPV. We would also draw their blood chemistry, which would include HbA1c, urea nitrogen, creatinine, and their electrolytes, including the sodium, potassium, and chloride. Would also check their tumor markers, including the CEA. We'll do CT of their whole abdomen. We'll do, of course, colonoscopy. We'll do the imaging, which is part of screening as well as diagnostic. We will do it via contrast barium enema or virtual, which includes the CT colonography. We'll also do a biopsy or a stool testing using cold blood or fecal DNA. So here we have images from a colonoscopy of different segments within the colon. I just thought it would be very beneficial to see what doctors would see when they go in there with the scope just to diagnose these patients, and that's what they would see. For treatments. So total resection of the tumor is the optimal treatment when it comes to malignant lesion that is detected in the large bowel. 5FU remains the backbone of treatment, is the preferred treatment. Fulvery and FOLFOX regimen are the most effective chemotherapy for colorectal carcinoma till now. We could also do monoclonal antibodies, and those are the medications that we use for them. We do post-treatment follow-up and surveillance after the patient has been treated for the cancer. The follow-up would include medical and physical history and exam, which is every 3 to 6 months for the first 2 years post-treatment. And if those results are normal, then their next follow-up will be every 6 months for 3 years. The CEA blood test would be also every 3 to 6 months for 2 years. And if those results are normal, then they would repeat that test every 6 months for 3 years. We'd also do a CT of their chest, abdomen, and pelvis, and that is done every 6 to 12 months for up to 5 years. The colonoscopy, that is done every 3 to 6 months when the patient has had no prior total colonoscopy. But for patients with prior colonoscopy, 1 year is the reason for post-treatment. For patients with no advanced adenoma, testing will be repeated in 3 years. And if those results are normal, then they would be repeated every 5 years. For patients with advanced adenoma, then that would be repeated every year. Those are my references. Thank you so much for listening to my presentation. I hope you learned so much and you enjoyed watching it. Thank you so much.